The biggest epidemic that I find in dentistry is actually dry mouth. Dry mouth is so prevalent because, as evolution has occurred, our sinuses have shrunk, so we're breathing more through their mouth, creating a dry environment, which leads to cavities, gum disease, acid reflux, and all sorts of other problems systemically. Now, that dry mouth is also happening because of braces. If you're a child that had braces, it doesn't allow the sinus to grow, so people end up needing air, right? It's the one thing we can't live without. So we end up breathing through the mouth, which creates, again, that just said dry mouth, and that ends up being a real huge concern. Also, patients on different medications end up having dry mouth. So that is the biggest epidemic that I really witness, and it actually doesn't get as much attention as it should. Mostly people or dentistry is always talking about cavities and gum disease, and it's pretty basic stuff, but they're not going into whole body health, and they're not going into airway, and they're really not looking at saliva and the types of bacteria that grow from a dry environment and what detrimental effects that it has on the overall health.